Hi, Sanjiv sir.
Hi Aditi, how are you doing?
I'm good. How are you?
Not bad.
So we have got launch also at 7 o'clock today.
That's right. That's
So
right.
yeah, we'll start in another 5-6 minutes, Sanjiv sir.
Sure.
Yeah. Hmm.
So how many people are you expecting roughly?
Actually, last I checked at 3 o'clock, we had received around 110 registrations.
Good God.
Yeah, but let's see how many of them actually turn up. So the average number for the previous webinars have been around 70, 75, 80. So I
Oh,
hope people do really turn up for the session.
ठीक है. Chalo.
Yeah. Actually, this has become, a complete wave of webinars. Every day there are like so many webinars being conducted.
Yeah, in fact, I'm surprised people still have interest because they must be utterly fed up of all the gyan that they're getting from various people.
Yeah.
This morning there was another series of Zoom calls with
Oh,
the Noka team on other
okay.
issues. Yeah, so I've been fairly busy all morning also.
Uh, I am glad you could take time out for this session.
No, no, for me also, there's a learning experience, no?
So we are streaming the entire session live on YouTube, so that in
Uh,
case someone misses it, they can attend it. Abhi, I would request you to please turn off your video. It gets slightly distracting. Thank you.
so Aditi, what is the discipline you want my video to be on? And
Yeah. For you, absolutely,
so,
absolutely.
okay, and Anupam is my co guest, isn't it?
Yes. So actually, he dialed in 5 minutes back, but then he dropped off.
Oh, or what else has been happening? Are you been busy?
Uh, but I guess everyone is busy, so can't really complain, Sanjiv sir. So we
No.
have one of the BIG grantees from previous cohort, and she was the speaker in our previous session. She is
Uh-huh.
a gynecologist. She is also working on a product development. She's got her own YouTube channel. She posts her videos, I think, twice every week. So after looking at her, I think I'm not in a position to complain at all.
Yeah.
Yeah, I am keeping busy.
I mean, that is amazing, truly amazing.
I know, absolutely.
That is truly amazing.
Yeah. We'll just wait for 2 or 3 more minutes.
No, not a problem.
Yeah. So the format for the session, Sanjeev sir, is I'll introduce you and Anupam to the audience, and then I will give a very short brief about the funding scheme, BIG, and
Right.
then yes, and then I will introduce you, and we take all the questions. You give the 20 to 25-minute session, then we move to Anupam, and all the questions we would take after the end, like towards the end.
Okay.
Yeah, yeah.
I don't know. I'll probably run out of material well before the 2025 because I
That's so, that's actually good, so that we'll have more room for interaction.
exactly. I was kind of hoping that there would be
Yeah.
more questions because then you can address
Yes.
specific concerns, queries,
Right.
clarifications, whatever.
Hmm.
Because just giving yarn at one level is not necessarily of any value.
So Anupam has also dialed in. He's just joining.
That's great.
Yeah. Actually, in first 2-3 minutes, we'll see a flurry of participants dialing in. So, hi Anupam.
Hello, Aditi. How are you?
I am good. How are you?
I'm fine. Thank you so much. I'm sorry, I'm late. We were just working, doing something here. We are
That's all
running.
right.
Sorry about
Hi,
that.
Anupam. It's Sanjiv here. Hi. Good afternoon. How are you doing?
Good afternoon, sir. I'm fine. Thank you so much.
So we're just waiting for a few more people to dial in, and then
Sure.
we'll start in another 2 minutes, Anupam. 4-5, we start sharp.
Sure. But anything in specific you want me to, focus on, speak, talk, or anything, not talk, or whatever.
Yeah.
Any heads up for me?
So yeah, sure, Anupam. So basically, today in today's session, Sanjiv sir would be covering the market penetration strategies and few things related to the manufacturing challenges that a medical device design company faces. And so from you, if you can share your inputs and tips that you've learned so far. And another thing that I would like to, because you are one of the mature BIG grantees that we have, Anupam, so if you could briefly touch base on what to expect after BIG, during BIG, some tips on uh, articulating the BIG proposal or pitching it. And if you can, you're more than free to add any further points on it. So
Fine, fine. I can do that.
yeah, the prime audience is basically people who are planning to apply for BIG. If not this call, then next call. And the entire cohort we expect, because the entire session is primarily for the healthcare startups. So we won't be expecting any non-domain related startups here or innovators. So
Okay.
yeah.
Okay. Got it.
I think I'm not okay. So in last couple of webinars that we have been hosting, we have had participants approximately 70 to 80, in fact, or above 80. In our first webinar, we had 99 participants, but I don't know what has happened today. I see only 80 participants. We had 110 registrations for the session.
Oh, even these are
So
high
maybe,
numbers.
sorry?
I'm saying even these are very high numbers if you ask me.
Oh, really? Okay, that's you're being too humble, Anupam.
I think this is exhaustion. People are just fed up.
Yeah. So I think without any further delay, I would officially begin the webinar. So welcome you all. Thank you so much for taking time out from your work from home schedule and your family time, etc., to attend this session and choosing this particular session amongst the current wave of webinars that is happening around the country and globe. So I would like to welcome the two speakers for today's webinar. I would like to introduce you all to Mr. Sanjiv Verma. So I met Sanjiv sir while I was part of the ventilator project that one of our own startup took up. And since then, trust me, it's been only 5 or 6 months, I guess. And since then, I've become a fan of him. And, you can just talk to him about anything and everything on the planet. So that's the kind of relationship I've built in with him. So Sanjiv sir is one of the alumni from IIT Kharagpur, and he's worked for I think almost 12 years with Baxter India as managing director. Then he went on to join as CEO India for Davita. Then he had various experiences with other industries as well. So his expertise lies in strategizing the market penetration, how to and advising companies on expanding their growth. So these are some of his expert areas, according to him. But like I said, you can talk to him about anything and everything. He has very recently mentored one of our own BIG applicant for in the previous call. So I'm really
Wow.
happy to have you, Sanjiv sir, for the session. In today's seminar, he would primarily be focusing on, some go-to-market related strategies, some challenges that a medical device company face when they move from ideation to scaling up. And yeah, he'll be briefly touching on those points. Then I would like to introduce you to Anupam Lavania. He's the founder of Bioscan Research Private Limited. And again, I have a very close relationship with Anupam because Bioscan was one of our first BIG grantee that I managed, and we have learned a lot together along the way. I learned a lot from the company and vice versa, I think. And Anupam, before starting Bioscan, he also founded a telecom startup company, I guess, Anupam. And then he also was a part of an incubation center in Ahmedabad. And he specializes in marketing operations. So you can actually ask a lot of business related questions to him as well, and he's already finished his BIG project, and he's in the phase of obtaining SIBRI fund and other follow-on funding. So yes, I welcome you all to the session. For next 10 minutes, I will bore you with the regular BIG stuff. Please spare me, because I'm not sure if everyone knows about this scheme. So very quickly, I will walk you through the entire BIG funding program, and then we get to the most interesting part of the session, which is the a session by Sanjiv sir and by Anupam. I hope all of you can see my screen.
Yep.
Cool. So before I officially, begin my presentation, I would like to inform you all that one of our startups, Noka Robotics Private Limited, are launching their second product for COVID patient, which is the high flow nasal oxygen therapy device. The product launch is scheduled today at 7 o'clock, and I've shared the link. One of my colleagues will also share the link to register for the launch event in the chat box, so you guys can register, and it is absolutely free. So Noka Robotics, during after the lockdown was announced, they rose to the occasion and started designing a sophisticated world-class ICU ventilator to treat the COVID patient, because that was the need of the hour. And in a matter of just 70 days, they developed this ventilator, which is comparable to the ventilators that we usually get imported from other countries. And during this process of designing the ventilator, they identified another major problem, another lacune which was there. So ventilator is required for the critically ill patient, but for the remaining patient, a very high level of oxygen is required, which is basically catered by this device, high flow nasal therapy device. So they thought that, after they have successfully designed and developed the ventilator, it was actually a piece of cake for them, and they developed this device in a matter of a month, and now today they are officially launching it. It is clinically validated. Many doctors have already tried and tested it on patients. So I would welcome you all to join this product launch session. And I am and I'm currently part of the Incubation Innovation Center team at IIT Kanpur, and I basically take care of all the bio related programs that we have at the Incubation Center. I am really proud to announce that apart from the ventilator, two other startups from the Incubation Center um, developed and commercialized COVID-related products. The one is an automated disinfection chamber by Cooper Health Tech Private Limited, and the another one is an N95 mask developed by Eastman Nanotechnology. And as you can see, our Prime Minister also wore the same mask during the inauguration of the Ayodhya temple. So the incubation center is, almost 20 years old, and over these years, we have developed a fantastic pool of funding schemes to support entrepreneurs at all the various stages of their entrepreneur journey, be it the ideation or prototyping or scale up, and even commercial, and even for commercializing. So this session is primarily focused on one such scheme, which is primarily for prototype development, and it's called BIG. So BIG, or Biotechnology Ignition Grant, is the flagship scheme started by BIRAC, which is Biotechnology Industry Research Assistance Council. So BIRAC was started by our government primarily with the motive to promote entrepreneurship in the sector of biotechnology across India. And among other various schemes, BIG is one of their flagship scheme, and the total worth is 50 lakh rupees pure grant and aid money, and you can avail it as an individual, meaning that you have still not incorporated your company, or if you have a startup, you can apply as a startup as well. So who all can apply for BIG, or when you can apply for BIG is if you have an idea and some preliminary data which supports that your idea is doable, is technically feasible, and of course has the potential to be commercialized in the market. So that's the stage when you apply for BIG, for developing that, for translating that idea into a tangible product, which we call as prototype, and for validation of your prototype. It could be related to field validation or validation in animal model, etc. So such kind of work gets supported under BIG. The total duration of the project is for 18 months, and like I said, the idea has to be commercializable. So it is not for a basic research. You need to have some commercialization component in the idea. Then coming to the things that are supported under BIG. So BIG encompasses anything that comes under the ambit of biotechnology, which in itself is, an ever evolving discipline in itself. So for the ease of the understanding, I have categorized the entire work into three main categories: healthcare, agri-tech, and industrial biotechnology. So healthcare includes medical devices, diagnostics, biopharma, vaccine, and also drug delivery platform. So our session, we will be focusing on only on healthcare, but to quickly brief you, in agri-tech, if you have any idea related to agriculture machinery, or for increasing the crop yield using either a fertilizer or some new seed technology, such ideas are funded under BIG. In industrial biotechnology, the conventional ideas related to enzyme technology, bioprocess, are entertained. And also another segment which is building up within industrial biotechnology is waste to value. So we see a lot of proposals coming from that segment being funded under BIG. This is a quick snapshot of some of the work that has been funded previously under BIG through SISC IIT Kanpur. And the first product that you see is basically developed by Anupam and by Bioscan Research Private Limited, which is a handheld device to detect brain hemorrhage. Then we have products wherein you can detect cervical cancer. The orthosis project is primarily led by a faculty member from MNIT Jaipur. So this scheme can be availed by the professors or the people who are associated with research institutes. The only catch here is you need to show your intent of eventually starting a startup company and commercializing the product. BIREC does not really want you to get money to develop the technology and then license it out. They really want you to form your company and take the product from bench to the market. So that's what the BIREC envisage for all the projects that they fund into. Then, of course, the pre-eclampsia detection device, which is again by a Pune-based startup. Then coming to the application process, the entire application process is online. All you need to do is just go to BIREC website, register, get your login ID credentials, and start filling the application form. While you're filling the application form, you would be asked to select a BIG partner. So currently there are 8 BIG partners and SISC IIT Kanpur is one of them. So it is mandatory to channelize your application through either of these 8 big partners. And in next couple of slides, I will emphasize why BIG partners play an important role in your application. Now you must be wondering, okay, fine, it's a 50 lakh grant money, good. I mean, the amount seems good, but why one should apply to BIG? I think Anupam would, back me up there that BIG is one of the most risk-free way for anyone who is venturing into the biotech space, because biotech space in itself is very capital intensive. It requires very skilled manpower, unlike other domains. So considering the amount, it's a very risk-free way to realize your entrepreneur dream. And after you get BIG, there is, there 90% chances that are that you will get some follow-on funding from one or the other sources. Another good thing, very practical USP about BIG is that BIREC has very well laid out the entire 50 lakhs into different budget heads. Like you can buy equipment, you can buy manpower, there's a flexible amount that you can utilize for consumables. You can file patent, attend international conferences, national conferences using the money, and there's a small component for outsourcing as well. And as I was mentioning that you get a short follow-on funding after you get BIG. So BIG is one of the ideation stage funding schemes, and after that you can avail seed funding. Again, SISC IIT Kanpur is one of the partners for seed funding as well. So you can get seed funding. Then there's SIBRI, BIPP. So which is primarily, these schemes are primarily for commercialization and scaling up your technology. The total amount goes up to 1 to 2 CR. So again, BIG, because it is highly competitive, but it is absolutely worth it. And the success rate is around 10%. So, which is still, I think, considering other statistics, is good enough. This is the last section of my presentation. So coming to the content of the BIG proposal, I have listed down some of the bullet points that constitute a majority of the BIG proposal. If you look at the evaluation criteria, a major weightage is given to the team and the commercialization strategy. So you really need to reflect your team very well on your BIG proposal. So if you're working on medical device or diagnostic, it is preferred to have some clinician on board, either as a core team member or as a scientific advisor to your proposal. Get in touch with them and show your proposal to them, take their feedback as well while you are drafting the BIG proposal. And for proposal summary, it is usually preferred that you give some statistics related to the problem statement, identify your problem statement well, and then align your proposed solution in alignment with the problems, the needs that you have identified. Use the concept note very smartly. Don't fill 10-12 pages. Use graphics and interesting preliminary data to make your concept note stand out, because trust me, evaluators don't spend more than an hour on evaluating your proposal, so you need to make the job very easy for them. Then for the last, like for the commercialization plan, I would leave it to Sanjiv sir and Anupam. They would share in their insight that how to um, they'll give you basics of the commercialization plan, the go-to-market strategy, etc. And last, why you should choose SIIC as your BIG partner is, the team takes tremendous pain in helping all the BIG aspirants, be it with the grant writing, finding a suitable scientific advisor. And this is not just pre-submission, even post-submission, we would assign you a technical mentor or a business mentor, and we do all of this absolutely free of cost. And sometimes we have seen the applicants don't even come to us that they require such and such facilitation, but still we go to an extra mile to identify the mentors for them and help them out. And of course, we have been into business for last 20 years. The IIT Kanpur alumni in itself is humongous, so we reach out to them every now and then, and we provide all the infrastructure facility, the co-working space, etc. So I would be more than happy to get in touch with any one of you who's interested in the funding. And yeah, I hope I did not bore you much with my monologue. I would now, I would like to now introduce Sanjiv sir. So over to you, sir.
Thank you very much, Aditi. In fact, you are a great one-person fan club as far as I can see. So good for my ego. Okay, so welcome, guys. Uh, what I'm going to do is I'm going to structure my talk to you. It's not a presentation. The idea is to have a discussion, and I'm going to talk to you about things which happened, and I'm going to use a real life example of an organization, a startup like you've got in mind or you already are running, and the sort of things which can evolve, go wrong. I'm going to talk to you about mistakes because everybody can give you gyan about successes. Few people want to talk about screw ups and places where things go wrong. So I'm going to use the things which went wrong to draw some conclusions. And I'm kind of hoping that that itself will stimulate you into thinking through your plan, your proposal, your thoughts, your ideas, in order that you guard against a similar situation happening. Because out of that will emerge a robust, solid, structured approach to your customer. Because at the end of the day, if I were to put one word on the screen, it would be focus on your customer. Who is your customer? The story begins back in 2010. It was a company called Embrace Innovations, and it's been one of the widely followed stories around the world because it was incubated by 4 young Stanford engineers slash MBAs who happened to be holidaying in Nepal in, I think, 2010 it was. And while they were there, they saw the abject poverty and the problems that birthing mothers were having with babies being born low birth weight. So what we call preterm babies. What is a preterm baby? Basically less than 2.5 kilos at birth. And we're talking about an average number used to be closer to 1.3, 1.4 kilos. Just imagine how low birth weight because of malnutrition, because of very, very inadequate diet, missed meals, whatever. So these four kids found common purpose and decided they need to do something about it. So back at Stanford, at the Stanford Medical School, they talked to some very, very collaborative professors at the business school and at the medical school. And they tried to understand what is it that can be done simply, which will enable a low birth weight baby to have a fighting chance of survival. And the simple point which came across was keep the baby warm. So, warm and ability to retain heat became the driving purpose of their product development and design. So, at the end of the day, they came up with the concept of a warmer which does not use electricity and online. It uses electricity offline or any other heat source to essentially transfer heat into a wax, and the wax is encased uh, in a former which transfers heat to the baby through a membrane and keeps the baby warm for 6 to 7 hours during the trials that they conducted, which was a great improvement for some of these mothers who really had nothing. Also remember that in a lot of our country, parts of the interior, far away from the big cities and towns, where electricity is a huge problem, many gynae and ob-gynae centers, birthing centers, don't have even infant warmers, the regular radiant warmers. And it's up to the mothers and parents to do whatever they can to keep these babies warm, including, strange as it sounds, live chulas kept near the dabba, which is what they call the warmer. Now, so they started off with a model which said, okay, so I need to get this product to the mother. Clearly, who's the user? The user is the mother. The beneficiary, the baby. Baby can't express an opinion, mother expresses the opinion. When does that mother actually get a chance to take a decision? Only if somebody comes and delivers this product to her, explains how to use it, shows how to use it, and then watches her as she uses it until she gets comfortable with it. So there was your customer. Who was going to get this stuff to her? The choice was various NGOs, global NGOs, local NGOs, offshoot partners, and that was the model that was envisaged. Well, guess what? They came to India at the end of when they graduated. All went to Bangalore as the then happening IT town in the country and set up a small facility to prototype and assemble these units. Um, while they were here, they obviously met lots of people. And of course, Indians are great at giving opinions and views and how we should do things or should not do things. And amongst the people who gave them views were a bunch of doctors, clinicians, hospitals like St. John's, AIMS in Delhi, all very helpful, but all with their own angle. And the angle was, hey, this is a medical product. This product is critical care. It keeps the baby alive. Therefore, it is a medical product. You remember, it started off not as a medical product, it started off as a warming device, like a blanket, like a razai, anything to keep the baby warm. Now we're talking in terms of the rules and regulations associated with medical devices. So as soon as you get into the chakkar of defining a medical device, the entire game plan changes. Now, their original plan was to make a product and deliver it to the mother for something like 1,000 rupees, 25 odd dollars at the then exchange rate. And because it was going through an NGO, there was no markups, no measure. And so very proudly, the whole world was told about this affordable, cheap improvement for the baby, life-saving, etc. All these lovely words were strung together. Ultimately, what happened is when through the offices of various hospitals, etc. in India, now we suddenly started to talk in terms of delivering it to who? To state governments. How do state governments buy? They buy through tenders. Who fills tenders? Distributors, sub-distributors, various agents, all sorts of people in the channel leading up to the ultimate user. So now who is the beneficiary? Nobody really can specifically put your finger on it and say the beneficiary continues to be the mother, but the process of delivering the benefit was through this extremely convoluted chain where everybody has a handout to collect their percentage of the revenue. So what was a $25 product suddenly became a $150 product. Why? Because now you're starting to put belts, braces, and whistles on it. You're starting to put electronic controllers. You're starting to put over temperature cutouts. You're starting to put things like over voltage correction, under voltage protection. As you start to design and redesign and indeed gold plate the product, it's no longer the product you started life with. So first learning is, for God's sakes, remain focused on your prime purpose. Actually, Steve Jobs put it very well. He said, focus is not about paying attention to the product which is in your sights. It is about paying attention to the 100 other good ideas which are trying to get into your vision, because that is what takes away your real focus, your energy, your ability to concentrate on delivering the promise that you made. Next point I want to bring out is the whole issue of positioning. Because at the end of the day, if you think about it, any product that you either visualize or actually put together, scanning devices, etc., which I saw, very impressive. Clearly, the designer, the inventor knew what was the intent and purpose of this thing. And therefore, who should I be pitching it to in order that its message is, number one, understood. Number two, the value proposition can be laid out in a manner which is logical, systematic. And it's about saying, this product has been made with different aspects of design in mind, safety in mind, fit for purpose. These are the essential requirements. And at the end of the day, it delivers the promise. In medical products, where there is a lot of confusion is in terms of who is the customer and who is the user. The two are very rarely the same. The user is a patient. The patient is really quite unconcerned about the nuances of the design. Who's concerned about the nuances is the using clinician. It could be a radiographer, it could be an obstetric personnel, it could be anybody in the whole area of diagnostics, but they are the people who understand some of the subtleties of what the designer has actually put in. Therefore, the value proposition is aimed at the user of the device, but the beneficiary is the paying customer, because ultimately it translates into a per procedure revenue which is earned. Now, if you think about it for a moment, what is the single biggest cause of worry for a clinician when he or she looks at a new product? First worry is, if this thing fails, it's my reputation on the line. If this thing doesn't do what it's supposed to do, my stature in my society will decline. So I need to protect my interests. And what is the best way to protect your interests? Do nothing. Stay where you are, status quo. So the biggest challenge for a new product coming from an unknown organization, a startup particularly, is to be able to carry credibility. How do you develop credibility? And that is generally a second part of my pitch to you, is that any effort and energy you put into, number one, capturing the key aspects of your product, the what, how, why, when. These questions have a bunch of answers which come into play in terms of, why is this product relevant to you, sir, at this point in time? Is because of, this is what you have. Here are the gaps in your current product. This is what my product fills. How do I know it fills? Here are the 3 reasons why I can show you that it sets right a particular gap or a particular weakness in the current offering that you are currently operating with. So you've got to be able to demonstrate that not once, not twice, repeatedly. So that's expensive. It takes effort, but thank God today with the technology that is available to us through communication, etc., which wasn't available to us when I was involved with Embrace, it's a whole lot easier to reach out to a influencer. This I'm using the word influencer as the individual or individuals who actually cause a product to be accepted or to be understood and recognized for what it is. So positioning, therefore, implies developing a set of claims, a set of propositions, which enable you to translate the benefits that you know. You're the designer, you know the benefits are there. How do I make sure that it is understood by the influencer? Not necessarily the consumer at this stage. That's another aspect, the next level up, because I'm talking about devices. Generally, devices are not sold directly to patients. They're sold to institutions or to people who are delivering a service. In some cases, you have a situation where a device is actually bought. Like, for example, a simple example would be a non-contact thermometer for temperature reading. Now, here it's a case of saying, here's the price, here's the proposition, here's its accuracy, this is how long the battery lasts. Those are tangible, measurable things which people can understand. But when you start talking in terms of bandwidth, frequencies, repair rate, restoration rate, and things like that, you're now talking to the seasoned professionals. So you need to be very clear who you're pitching the ideas to. In Embrace, they were talking to doctors, but they completely forgot that the beneficiary in this case was a mother with a baby. And the mother with a baby, typically a poor mother with a baby, because if you've got money, you would be in a fancy hospital with radiant warmers, etc., etc. You don't need a cagoule with a warming facility. The other strategy which typically comes and bites you in the rear end is the fact that when you run into a problem, you suddenly start throwing your hands left, right, and center. Okay, what else can I do? So in the case of Embrace, they said, oh my God, selling in India is so difficult. Let's sell overseas. We've got lots of contacts, the WHO, Bill and Melinda Gates Foundation, Beyonce. They were all people who were supporting Embrace publicly. So let's go and sell in Africa, Southeast Asia. But the problem was, then you're starting to look at getting CE marking, getting US FDA approval, doing clinical trials, validating the clinical trials, doing extended surveillance to create a body of data which can be put in front of the researcher, the people who are going to evaluate your product. And all this costs money. So we went and got money from the Khosla Ventures Fund and from Capricorn Partners, two Series A funders who actually, out of a deep commitment to the area of infant mortality, committed something like $1.5 million each to the kitty. So everybody felt, oh, this is wonderful. All this money has come in. So we can now go full steam ahead. So what did they do next? They hired lots of people. One of the people that was hired at that time was, in fact, the point that Aditi made just a bit earlier, was a clinician, somebody who talked the doctor's language. Because till then, these four youngsters had no clinical skills or knowledge with them. The result was we now had a person who could actually have a dialogue, could actually talk to the doctors, could counter their objections with clinical arguments. Very important, because doctors hate talking to non-doctors and they sort of poo-poo them, say, no, you don't really know. I'll tell you what it's all about. You must have a doctor on your side. So this gentleman, wonderful man, also from Bangalore, brought home the bad news that, look, we are never going to win this battle, because if we continue down the clinical path, we are having to develop a class 2 medical device, which it is not. we are spending enormous sums of money, putting belts, braces, whistles on this thing to try and make it behave as if it's a CAT scan machine, when it's nothing other than a bloody blanket with a wax pod inside. And actually, for the first time, flagged up the fact that this is the wrong way. This is the not the way forward. At that time, it was back to the drawing board. But remember, at this time, you're spending $200,000 a month on your team, on the manufacturing facility, on all sorts of stuff happening around you. But reluctant government wanted 3 years P&L in your and balance sheet in order to tender. Now, this is a startup company. Where are you going to get 3 years of P&L and balance sheet? So back to Delhi, representing to health minister, this, that, the other. All of this, I have personally sat around for hours on end. Even after you did win a tender, the whole process of delivering the product to a particular place at Jumri Talaya, somewhere, some health center, and supporting it, all of the Anganwadis and the Asha workers who needed to carry the product to the mothers, it is an enormous task which nobody had even visualized. So, next learning, please make a note. You must walk the talk between yourself and your ultimate user. Please track where the product is going to go if things go as per your plan. I'm sure you'll find en route many little bottlenecks which you need to uh, remove, or obstacles which you need to overcome. Walk the talk, see what you're doing, check, validate all the time, because it's not over until the last mile is connected. On the, I mentioned manufacturing in passing, and I'm just going to spend just a little bit of time on manufacturing because it's very comforting for a lot of designers to say, okay, I'll take care of manufacturing. I know the product, I know how it's done, I put it together in the lab, piece of cake. The reality of manufacturing is another completely different beast, because you are putting money upfront for an asset which will only pay back when it is fully utilized, or at least significantly utilized. So unless you've got really deep pockets, that money is dead investment until your volumes pick up to a level where they're able to support through margins, support that capital that you have invested in. Now, if you go back to the cost of capital, today it's a lot less. But there was a time when cost of capital, along with the loss of opportunity in that money, was something of the order of 18 to 20% per year. So you're talking about 2% per month, which is a lot of expense for monies which you do not see a return on. So do not get involved in significant manufacturing activities until you have visibility to a product which is well defined and where there is a certain step up in volume that you can look at. Then you know that I'm on the right track. If I get into manufacturing and I can take advantage of my design. Another point in manufacturing which you need to think about is that as a country, though the Prime Minister in all earnestness is interested in Atmanirbhar Bharat and must manufacture for India, manufacture for the world, the reality is, I say this to you with complete and utter conviction, that we are not really a manufacturing friendly nation. Our rules and regulations are parochial, they are state specific. There are any number of barriers to free movement of goods and services. Our labor laws are cumbersome. Your ability to acquire the right people at the right time for the right price are restricted by a whole bunch of issues. I don't have to go into details on that, but the fact of the matter is, embark on manufacturing with a lot of care. Much better, I suggest, in fact, even with NOCA ventilators, was to look at the concept of either contract manufacturing or licensing, which is your design, your intellectual property, licensed out to an entity with underutilized capacity. They're happy to utilize some more of the capacity. you're happy to pay them to use their facility, because you have the right to then see how they do. They don't do well, you can always step away. But this way, at least you get a chance to go into the marketplace with the product without the kharcha of your own facility. So I've mentioned out licensing, sharing of risks through that process. Um, our laws takes excise duty, for example. It's a weird thing, because excise duty and various other local levies, etc., although much less now than they used to be, but they're still source of enormous amount of complexity, and therefore just takes away from your prime focus. You are not really sitting out there packaging cardboard boxes full of your stuff. You're interested in the design, you're interested in the evolution of the product, improvements thereof, observing it in use, incorporating improvements into the design, rather than the nuts and bolts of putting it together and shipping it out to a customer. So embark on manufacturing with a huge amount of care and safeguards. um, I think that pretty much covers the embrace story, and I'd be happy to then answer questions which come up from people's own experiences. But wherever I've been, including with large companies like Baxter Healthcare, like Davita, money was never a problem, but getting clarity of the channel to the customer, getting clarity on how do I pitch the service or product that I'm offering, that it appeals to the person who's going to make that choice. Dialysis is a good example, because there what happens is the patient is the last person who knows anything about anything. He's just a poor, sad individual with a lot of problems. The individual who takes the decisions there is the nephrologist, who chooses your therapy over somebody else's, and the operator of the dialysis center, who has got commercial interests in terms of what revenue he or she makes, how much margins he or she makes, what are the add-on expenses and costs that they can make available. Those are different needs, and you need to look at all of them, because they are players, they are participants, they're interested parties. You need to map your market environment as much detail as you can. And if you think you've got it all, start again, because you haven't. There's always something more that to learn and improve in your knowledge of the marketplace. And you'll have success, I can tell you, but it's a slow, painful process, step by step. That's the way to go forward. So at this stage, I'll take a break and then see what Anupam has to say, and then we move on to questions after that, because Anupam is going to tackle this from the investor's point of view, from also from the fact that he's got a successful entity operating. So he's been down this track. I'd love to hear from him.
Thank you, Sanjiv sir, for such an enlightenment 20 minutes. I mean, you've walked us through all, right from the product designing, then focusing on the main beneficiary of your product or intended innovation, then segmenting customer from user, then also some manufacturing related issues, and also for mentioning the complexities of the excise related stuff. So Anupam, over to you. Please enlighten the audience on your entire BIG journey, and if you want to, take some of the points from Sanjiv sir's session, and if you would like to comment on them.
Sure. Thank you so much, Aditi. First of all, Mr. Sanjeev, I'm really impressed because, whatever you said, I wish I knew the content. So what I would have done is I would have just seconded you on whatever you were saying. Because whatever each and everything that you said, I could see my journey, When you said product positioning, we were talking to the right person. When you said manufacturing glitches, going to the government for sales, for tendering, each of those things. And I can put exactly these things when I face them, And when you said, I was almost in tears when you said that when you started off with a thing, with a device or with a, what should I say, a prototype or something, with something in mind. But then a lot of people demand whistles and whatnot, packaging and certain way and all that. We faced all that, and everything has been delayed at our end. Also because of that, we face a lot of problems. It costs money, costs time, it costs credibility, a lot of things. Exactly. And credibility, as you said, is extremely important. So I think you've covered more or less of most of it, I think. I mean, because this is exactly what I have experienced. Um, and because you specifically mentioned about investors' perspective, so let me put some light on that if time permits. I won't take more than 2 minutes, and then we'll open for questions, I think. So investors, see, it depends. We've been talking to private investors. We've also talking to government investors, BIG and others included. We have got funds from both. So after BIG, there's a follow-on grant which is called SBIRI. We have granted that as well. Now that what happens is, but it appears to be very simple on the outside, but it's little complicated. I mean, I'm talking to people who are embarking this journey afresh. I mean, people who are experienced would know that, but people who are embarking this journey of entrepreneurship, especially innovation related and invention related entrepreneurship, it's it's appear very glamorous on the outside. I mean it's great. I mean, one things come out, it look very good, but there's a lot of things that go into it, and it's not that easy. So you have to be mentally prepared, and be. I think one has to be prepared. To I mean, you always have to go in without any expectation, whatever you do, whether you are going for manufacturing, talking to your customers, talking to your investors, talking to anybody. We talk to investors almost every day. We have a lot of private investors. You're talking to a lot of people who are yet to invest, people who are saying that I won't be the lead if you get the lead. A lot of things are happening. We have institutional investors that we're talking, and we're talking to private investors, angels, Indian, abroad, mainly abroad. So it's complicated. So I'll just talk about the investor bit, because rest all is just ditto. I can just ditto, and with sir, I mean, great, sir. What you have said is amazing. I mean, I have nothing more to say. Only I can give examples from my journey, which will just second what you say. But then, nevertheless, what I'll say is about investors. Yeah, so investors are different kind of investors. When you talk about once you mostly investors are interested in minimizing risk and maximizing the growth of their investment. Now, if investment maybe in terms of monetary, or maybe in terms of their time and expertise, the credibility, the brand, the various kind of investment that come into picture. So I'm calling all of them, investors. Know what happens is owners is totally on you all the time. So, and investors have their own. So you should understand that if you're raising from investor A, let's say, this investor A will be looking for monetary growth. So you need to strategize that if you really are, whether your mindset and the mindset, or rather the priorities of your startup or your company and yourself and the founders is in alignment with the investors or not. If it is not, there may be glitches eventually, and more often than not, there are glitches. If the mindsets are not aligned, so you have to be very careful about who you taking the investment from, and you should always in I'm not, without any prejudice, just out of my little bit of experience that I have, and because I have my core startups also around, and I've talked to a lot of startups, I've understood that what we as startups should do is we should take responsibility of everything. See, governments, ecosystem, and everything, they are there to support. Sometimes it will work in your favor, sometimes it may take a little more time, but end of the day, if there is a problem, you can't blame anyone. We are the ones to be blamed. I mean, if let's say government tender and it could not pass, like we working with one of these, trying to work with some governments, and eventually we made all the changes that were suggested by the distributor, as sir rightly mentioned. We did all the changes to the packaging, to the price. We got the certification that were needed, and after that, what happened is, of course, you could have delivered the product in, let's say, 2 months, and that is when they needed it, not before that. But then the problem was, a final straw on the camel's back was they wanted a DSC class 3. So we have a DSC class 3. Now there's something called digital signature, for those who are not aware. Now again, after doing all of this, just because of that small thing, we had to back off. But backing off costed us a lot of things, lot of things. The credibility, all that packaging that you're seeing, a lot of things, a lot of investment, money, time has gone into it. It's not a big thing. We could have got it, but then it was just going on and on. So you have to be very careful about your investors, as well as you have to understand, you have to empathize with your investors, and same with your clients or customers and users, as I rightly said. And of course, product positioning is a challenge. I mean, we were pitching to neurosurgeons. Now we know that the place where it be used is a trauma centers, wherein the not really the neurosurgeons would be there, but most likely the resident doctors or the emergency doctors on the watch would be there. They may not be neurosurgeon. More often than not, they are not neurosurgeons actually. So they are the right people to sell. So all those changes have been, we have learned it the hard way, but because sir is telling and people know, I mean, there's an easier way to learn by these. Anyway, I think anything specific that you want me to cover, or let's open to questions. I think I'm taking too much of the time.
Yes,
I
yes,
think that's a good idea.
Yeah. So anyone who wants to ask any questions, please show me a raise of hand. During the conversation, I think Vivek wanted to ask some question. Vivek, are you still there? All right. Okay. So does anyone have any questions?
Aditi, are they muted by you from the center, or can they
Vansh has a
unmute
question.
themselves?
Yeah. So two participants have raised their raised their hand. Vijay. Okay. So Vijay,
Yeah,
I think you are on. You've unmuted yourself. Vijay, you can please ask your question.
yeah. Hi, Aditi and Verma sir and Anupam.
Vijay,
Very
can
nice.
you be a little louder? We can't hear
Yeah.
you
Okay.
well.
Now I am audible.
Yeah.
Yes.
It's okay.
Thank you.
Yeah. Thank you, sir, for your very good talk. I am a principal scientist in CSIR IHBT Palampur.
Okay.
I heard your whole lecture. So for me, I have around 2-3 patents. One is for anti-acne cream, which we had developed with the help of IGIB Delhi. So should we get some industry in this, or we can go for clinical trials? Like we have developed this from essential oil based, and we had applied already for patent, and it have a potential to go in the market. So whether this big grant way will be for us or not, and how what will be the way to go through this grant?
So, Aditi, if you can address whether BIG grant is applicable, number one,
Hmm.
and
Hmm.
then we can talk
So
about the.
yeah. Yeah, I'll take the second half of the question, Sanjiv sir. So, Dr. Vijay, it is applicable. I mean, you come under the ambit of BIG. So, primarily, as long as there is some more technical development that needs to be done, you can apply for BIG, but you will get, like, if approved, you will be the one who will receive the funding and not your industrial partner. So, I hope I answered your question, Dr. Vijay.
Uh, Actually, in start you mentioned that once the product will be developed, you can't
Hmm.
sell this patent to industry or something.
Oh,
Because
okay.
I
Uh, no. So maybe I did not phrase it properly. What I was trying to say here, Dr. Vijay, was sometimes, like in many of the cases that we have happened in the past, what usually the scientists who are employed with government institutions or the professors, what they do is they develop the technology and then just license it out to a third party who would manufacture it, who would commercialize it. So basically, all you will get would be some royalty from the licensing. So this is not acceptable for BIREC, but BIREC allows you to start your company and say bring on board some industrial manufacturing partner, get the manufacturing outsourced to a company, but you should be the one eventually commercializing, like taking the product to the market. So you should not just sit after developing the technology and then that is it, your job is done. So that is not acceptable for BIREC.
thank you, Aditi. In this, if this is the case, then
Hmm.
so after development of this product, as I am government employee, so I will not be involved in marketing and ETCs, whatever is there
Hmm.
as per
Hmm.
norms. But industrial partner can go. So whether is it that our industrial, we should go for industrial partner and through them we should start this big grant, or something. Please guide me properly.
Okay, sure, Dr. Vijay. So, see, you said that you are employed with one government institute, right, sir?
CSIR.
Uh, so,
CSIR.
yeah, okay. If it is CSIR, sir, I'm not sure CSIR has policies in place where they would let you form a startup company.
As a
So,
government employee, yeah, I can't. Maybe I can't.
yes, so actually that's the problem with most of the CSIR institutes, because as a part of the application process, you need to obtain an NOC from your research institute. And in my own experience, I have seen many like scientists coming up from CSIR with good ideas, but because the institution doesn't let them to take on the entrepreneur journey, you become ineligible for the grant.
I think the IP is also first call is with CSIR.
CSI, right. So, yeah. What you can do in this case, Dr. Vijay, is there's another scheme called PACE, started by BIREC. That's again 50 lakh rupees. So that you can put in collaboration with your industrial partner, and the industrial partner can take it forward from there. So PACE will be the more appropriate scheme for you, sir.
Pace. That is also
Yes.
right. Thank you so
Yeah.
much. Thank you so much, ma'am.
Sure, no problem, sir. Vansh, you can go next. Vansh Verma, I see you. I see your
Man,
hand
I have
raised.
a business model, business idea, but there is no appropriate funding for it. What I do? Hello,
Vansh, can you please repeat your question?
मैम बिजनेस आइडिया तो है पर फंडिंग के लिए मैम कहाँ जाएं?
Okay, so this was one of the many schemes that you can avail, Vansh. What we can do is you get in touch with us over email. Then maybe I would, we have other entrepreneur in residence kind of fellowship based schemes. So wherein you can further work on your idea, and then maybe prepare yourself for BIG, Vansh. So connect with us offline, like over email. My team
मैम
would, yes, Vansh?
मैम एज इज इम्पोर्टेंट इन स्टार्टिंग अ बिजनेस.
No,
No,
not
I
in the
don't
least.
think so.
हेलो,
No,
आप
your
बिजनेस के लिए पूछ रहे हो कि
तुम्हारी
बिग के
औकात.
लिए?
your enthusiasm is important.
तो
ओके
आप
सर,
इसके
थैंक्स.
बीआईजी स्कीम के लिए पूछ रहे हो कि एज इंपॉर्टेंट है, या बिजनेस करने के लिए या एंटरप्रेन्योरशिप करने के लिए? बीआईजी स्कीम के लिए पूछ रहे हो या आई डोंट नो
सर आइडिया तो है, मतलब अगर बुलाया गया तो एज वेज सर इम्पोर्टेंट करती है नहीं, ये पूछ रहे
नहीं करती है
बीआईजी
वंश.
हैं.
नहीं करते.
नहीं करती सर. एंजल इन्वेस्टर सर मतलब कितने तक फंडिंग दे सकता है?
कितनी चाहिए?
2 करोड़.
क्यों? अरे भाई चलिए ठीक है. I think Aditi would want to take it offline. I mean, I can talk to the, if you want. You can connect me to him. I can tell him how the whole system works, I think.
That will be
Sure,
good.
sure,
That will be very good.
thank you. Then there was another one. Mr. Sudhanshu wanted to ask question. Sudhanshu, are you there?
Hello.
Yes,
Hello.
Sudhanshu.
No, ma'am. Actually, I'm Anand Sharma, not Sudhanshu.
Okay. Yeah, please go ahead.
Yeah. First of all, thank you so much for giving the such kind of opportunity for us. Actually, I'm Anand Sharma from. I'm a student currently. I'm a student pursuing my BE degree from Nagpur. When I was in third year, I manufacture a small equipments which is related to the agri-tech. So at that time, I didn't know about such kind of things that I can start my startup in my further journey. And but after that, with a connection, with a collaboration with my senior, one senior students, and then we meet and try to develop that particular things, from that particular single product to a startup, to just to make a development in the agri sector. So currently I have I have totally manufactured this agritech product, and as according to the marketing survey with that product, currently I have more than 100 plus customers available. But only the problem is that I have no much funding so that I can manufacture and develop our own sectors, like a startup. So I just need support from you, such kind of things, such kind of opportunity which you provided here.
Sure,
So
Anand. So, yeah. Do you have any more question, Anand?
no, it's enough.
That was so. Anand, we done an agri-focused funding scheme with Tata Trust. So
Yeah, yeah.
just drop an email to us. I will connect you with my team member who looks after that program, because you already have customers and traction in place. So I think that would be a more suitable scheme for you. BIG is primarily for prototype development, for developing your product. But as you said that you already have some customers on board using it, so if there is some R&D component that you would like, you would like to still work on with your product, then we can discuss the possibility of VIG. But if you want it primarily for like scaling up and selling it, then the agri focused program would be more suitable.
Actually, ma'am, it is related to the R&D. Like I can say, this is the innovative product.
Hmm.
It comes under the monopoly. No other or no, there is no any competitor for this particular things. And that's why from the college level, I try to start in the college. And actually, I also appreciated by the MSME.
Hmm.
Uh, yeah, I take a part in the event, and there the Nitin Gadkari ji was very appreciated for that particular things. And but still, for that in that level, my institutes gave me a small fund just to grow up. And
Hmm.
with the help of that, I just try to make I just do a market survey of that. And that's why the no, most of the farmers are very happy with that product, and so they are ready to take it. But only the thing is that I need a support, more support from
Okay,
to just
cool. So Anand, yeah, maybe you get in touch with me and I will take it up offline, because this is related to agriculture. I mean, the forum is
right.
for
Aditi, you
health.
please
Yeah,
connect him to
yeah,
me.
Yeah,
sure,
yes, sure. Yeah.
sure, sure, Anand. Please don't forget to drop an email to the team. We'll get in touch with you.
Yeah.
Um, okay, Anand. Yeah, we'll
Nishant
type in
has a
the yeah. Next question, Faizan Shah. So Faizan, if you have any questions for Sanjeev sir or Anupam, I would be more
Uh,
than happy to take it. Yeah.
Hello, good evening, ma'am. Actually, I have a very general question, not related to this, but I am a product design and development student from MNNIT Allahabad, and this session was really very insightful for me. And I think such more sessions should be conducted. So, if Sanjeev sir and or the other sir, I am not able to recall his name. So if you can conduct such more sessions in collaboration with our institute, it would be really wonderful. Thank you.
Sure. So I'll have to check with your availability, Faizan. Sanjeev sir is an extremely busy person. So, but yeah, we would be more than happy to maybe do one session with your college, Faizan. Yeah.
Nishant Agarwal has a question.
Thank you, ma'am. Hello, sir. I have a question for Sanjeev, sir. Regarding bio-incubation grant, since it involves 18 months of funding, I was wondering what is your take on the accelerator program? So whether one should go for accelerator where like 6 months of progress can be converted into equity-based funding, or we should go for grants like BIG and others?
Nishant, I would have difficulty answering that, largely because it's very much more in terms of you thinking. milestones. And so I'm not sure I'm the right person to address this question to.
I understand, sir. So maybe I'll mail you about the things I want to ask specifically, and we can take it
Let's
over.
do that offline.
Sure,
We
sir.
have already have our contact. We can talk offline.
Sure, sir. Thank you so much.
Nishant, by the way, Anupam has been part of a couple of accelerator, including one in Israel, I think, Anupam. So maybe Anupam can answer your query.
Yes. So if so, here's what I think about it. I've been a part of various accelerators and raise funds from there. But see, please understand that funds, if funds is what you're looking for, if that is all, so we have to know what we want. If in this grant what you get is funds and some kind of you also get a kind of credibility, a brand and all. Okay, so that is also important. So if you're a big grantee, that's again a big badge that you can carry on. So that is very important sometimes. Funds, accelerator, but in accelerator again, I'm just giving a comparator. Choices of obviously yours because you have to know your priorities. Accordingly, you'll have to decide. But I can just give you pros and cons very quickly. So here is the pros. If you go for accelerator, what will happen is you will get more specific mentorship and learning, and because they have curriculum to follow, and they have, so your learning may be better there as compared to a grant, because grant is a grant, and then of course then it depends on your partner. If IIT Kanpur is your partner, you can get a lot of mentorship, but there may be other partners which may not be able to provide. So it depends on which partner you choose. But if you go to a specific accelerator program, there's a lot of learning that happens, a lot of connects that happen. And connects are actually very important when you cross your POC and you are going to the market. Network actually helps a lot. Now, taking money again is how much important is money and at what cost you are ready to take. In accelerators may or may not take some equity against it, or they may have different models. So that again you have to compare. This BIG, as far as I am aware, I don't know if it has changed now, but it is a grant which is equity-free grant, so they don't charge any equity, any royalty against it. Aditi, please correct me. I don't know. In my days, that
Yeah,
kind of
there has been a royalty component added to it, but yeah.
So again, you have to compare the deal versus deal. Now it's apple to apple. So if accelerator is giving you X amount for X Y equity and this is giving you X1 for Y1, that is a straight comparator, direct, objectively comparing, because as I understand, money is all you're looking for. Now, if you're looking for other things, then you have to see that accelerator gives you other things, but then it takes little more time, and there's also element of risk, which means an accelerator eventually at the end of the program may or may not give you those funds if funds is all you're looking for. But in grant, if you're selected, you got the funds. Sooner or later you'll get it. I mean, the dispersal depends, but again, you are still, you have right to get those funds. But an accelerator you don't have. Just because you got through a program doesn't mean you'll get funds. End of the program, there's a D day. They call it demo day.
Yes.
And that if you get through, you may or may not get. So these are the pros and cons. And then of course, with grant, you can work at your own place. I mean, I don't know where you're calling from, but whichever city you're working from, you can continue to stay there, especially for the BIG grant. They don't want you to relocate to Delhi or anywhere else. Whereas the accelerator program may want you to relocate yourself to the location where the program is being conducted, India, abroad, or in India, somewhere else, which may or may not, depending on your constraints, your professional, personal constraints, you may not be able to travel. So that you'll have to. These are the pros and cons that you may want to consider.
Yes,
Any
I
specific
understand.
details you can connect with
Yeah.
me.
Thank you so much, Anupam. I was a part of iShow India, and I saw your presentation as well. So I was talking in context to Engineering for Change ASME's accelerator program. So anyway, I'll talk to you over emails as well.
Yeah, ASM. Yeah, we are the winner of ASME. We were the number one healthcare startup there.
Yes. Thank you
Fine,
so
we
much.
can.
Yeah.
No problem. Anytime.
Thanks, Anupam, for answering. I mean, you did much more than I would have able to. I would have defended that question. So, Sanjiv sir, there's one very generic question for you. Based on your experience on medical devices sector in India, what will be your key takeaway points that need to be taken care of? And this question has come from someone called guest. So I don't know. I wasn't able to identify the person. Would you like to take this question, because it is a very broad question that the person has asked?
It covers the entire talk actually.
Yes.
So in fact I read it on the chat, and I started struggling to put words together in simple sum, but I thought maybe what I can do is just from my own notes, one thing that leaps out and tells me is from a who is the person that you are intending to satisfy. There has to be clarity on what is the point or purpose of the product or service or device, whatever it is that you have pioneered, developed, invented. What benefit is it going to deliver to a user finally? And then once you've got the user clear, there's a patient there with, let's say, emphysema or something, struggling to breathe. Who are the people en route on whom this patient depends? And that is the path that you need to map, because all of those people are interested parties, either in terms of delivering a service to that patient or enabling that patient to afford to pay for this improvement. It could be a funding agency, it could be many people are involved in ultimately connecting the dots between a product in an inventor's portfolio and a user who is a beneficiary. What you have to do is map each of those players and then find a reason and logic of why they should switch to your product rather than something else or do nothing. If you can put answers to these questions, you'll find yourself with a marketing plan, basically.
That was very well summarized. In fact, I've noted it down. So I think we have one last question from Abhay Goyal.
Yeah,
Abhay, are
hi.
you still? Yeah.
Yes, I am here. Sanjiv sir, your talks were so excellent. And as I would uh, uh, agree with Anupam that whatever you said is exactly true. Sir, I am Abhay Goyal. I am a uh, pass out from IIT uh, 2000, and I have been into herbal extracts. Sir,
Okay.
what I have done, I have made a cure of COVID, and sir, I have till date treated almost 15 people who had a positive
Yes.
report. And sir, around 500 odd people who are always family, friends, and the near ones, they are also taking my formulation as a preventive cure. Sir, I want to uh, have all those um, lab tests done and the human vocal trials done, would get the approvals of the government, of the Ayush bodies. So, sir, what I was thinking that is it the right place for me or not?
Abhay, I don't think anybody can answer that question hand on heart. Is
Okay,
it the
sir.
right place, wrong place? Don't know. I have no idea. More importantly, how convinced are you that number one, whatever you have as a formulation
Yeah.
delivers what you think it does, number one. And the next stage is to demonstrate that to somebody who is interested in you use the word cure, right? Now, cure has a multiple meanings for multiple situations. A
Yes.
common cold, if you leave it and do nothing, it'll cure in 6 days. If you have lots of drugs, etc., it takes 1 week. That argument is there. So, what is the cure and whether clinically it is sustainable, that you have to demonstrate. I'm no clinician, so I really can't answer this. Maybe Anupam has some insights which he could share.
Yes, Anupam, please help me.
Yeah, sure. So I understand that as you said, that you have a cure for a herbal cure for corona. That's wonderful. First of all, congratulations if that has been achieved. But frankly speaking, the first thought that anybody would get is, that of non-belief. I'm sorry to say that we are startups.
No, no, no.
So what
It's true.
happens is nobody will believe it unless you have a proven thing. By proven thing, what I mean is you need to do conduct clinical trials for that. That is very, very important. You have to conduct clinical trials, and you have to calculate the sample size based on. There is a standard calculation. If you need, I can help you with that. There's a way to calculate a sample size which is acceptable for a specific task. It depends on various factors. Then you need to have certain amount of specificity, sensitivity, and that has to be conducted by a recognized third party. And after that, once you have that in place, then you have to go for further certifications from Ayush body and whatnot. You're saying, which is right. Once you have all those in place, that is when you go to the market. But that is how the story is. But Ayurveda, if it is Ayurvedic medicine, I'm not into Ayurvedic medicines, but from whatever I know, from whatever my friends know, Ayurveda is not that kind of regulated. It's not, the regulation is not very high. However, there was a recent notice from government in the last MDR. Within next 18 months, everything is going to be treated as a class 1 device, which means everything will be regulated. Nothing will be unregulated within 18 months. So I've read that somewhere. So in that case, anyway, you will have to prepare for all the trials and everything. So that if you want to commercialize it, if you want to just help your friends and family and your mohalla, gaon, whatever, it's a wonderful thing. But if you want to take it commercial, you want to make money out of it, you need to have credibility, for which you need to have clinical trials. You need to have certain amount of certificates for efficacy and safety. There are two things that you have to worry about. One is safety, which means nobody will be, it won't cause any harm to the person who's ingesting it. Second thing is very important is efficacy. If there's no efficacy establishment, there's a problem. You know what happened with one of the established brand in India, right?
Yes, I know, Anupam.
And so you know how the story. So this is how
Yes.
journey you should plan if you want
Just
to
to
commercialize.
add to Anupam's point, I think the first step would be to appoint a lead investigator, which is a doctor, who
Principal
is a
investigator, yeah.
registered practitioner, and he then becomes the owner of the clinical study. And he is the person who is authorized to hold a clinical trial. Then you come back to Anupam and talk to him about size of sample and the amount of time it takes. What is the cohort? It's a double-blind study. The product is given to some people and the placebo is given to somebody else. All of that discipline has to be followed for that doctor to then write and publish in a clinical journal. So his peers will then review that and say, this is garbage, or yes, this makes sense.
Exactly.
Those are the steps we need to take.
So the first thing is you have to create a protocol, and get a PI.
Yeah.
Yeah.
Okay. Anupam, I've made such things, and we already have a doctoring team who is coincidentally my sister also.
Wonderful.
So yeah, we have done some work, and I have done some testing which says that the product is free from like any of the chemicals or the heavy metals which are usually associated with the herbal things.
Yeah.
So
But
yes.
then, anyway, go ahead. You were saying something, sorry.
Yeah, but I want some more things which needs to be done. So my question again, if Aditi also can help me, that is big platform for me for me to go ahead. How can like big people help me in establishing like all these clinical things or the scientific things?
Sure. So Abhay, definitely it comes under the again scope of PIG, Abhay. But my own prior experience with herbal formulation is that even if I've seen a very less success rate when it comes down to Ayurveda related projects in Bhairag. So most of the time, the experts say that why don't you approach Ayush? Ayush would fund you. So unfortunately, this has been the case. But
Mhm.
yeah, I mean, I can, if you want to give give BIG a try, I would be more than happy to help you with all, laying out the objectives and stuff. So yeah, I mean, but
Okay,
I've
okay,
I've been actually very honest with you about.
okay, okay, Aditi. Thanks for your feedback, but still, I would give it a try. And thanks,
Sure, sure,
Sanjeev
Abhay.
sir
Yeah.
and Anupam. Thank you so much for your time.
No problem.
Thank you so much.
So,
Thank you.
Sanjiv sir and Anupam will take one last question. So, this is for Anupam. It's from Prakhar. So, he basically wants to know your experience during the final presentation interview round. Any specific criteria the selectors give more weightage to? So, Anupam, this is for you from Prakhar.
Yeah, sure. So, any specific criteria? See, criteria are listed. Aditi did mention about those criteria in her presentation just a few minutes back, probably an hour back, a few minutes back, whatever. So she did mention about that. Then those are the criteria along with the weights. She'd also mentioned about the weights. What is 30% weightage, what is 10% weightage. It's very clearly mentioned. So that is a obvious fact. But again, if you want to know something more, insightful, because out of my experience, I would say what happens is, see, we all are human beings. In the committee, also everybody is a human being. If they believe in you, if they think that, see, in that 1 hour, let's say, and 1 hour is too much, but even in 1 hour, it's very difficult to understand the past and the future of your product, of your team, of your technology, of the efficacy, everything. It's not humanly possible, frankly speaking. So what happens is, it again, end of the day, it is also, what they feel about when you are saying. So how good you can utilize that time. See, there are two approaches. I'll say one is not so good approach, one is the good approach. According to me, I can be totally wrong, by the way. The good approach, because I've been rejected in the first time and I got through the second time, so I know both the approaches well. So what happens in the bad approaches, I went on, like, I filled up the form nicely, I filled up all the details as they were mentioned, and I thought I'd done my job, and I just submitted it. I went there, we presented it, whatever. Result was not good. Second time, we did the same, but this time, I'll tell you what. Frankly speaking, I put little more heart into it. The device was the same, the solution was the same, the team was the same, everything was the same. The prior art was the same, the future was the same. It's just that we put more heart. When we put more heart, what I mean by that is, you have to believe in it before you enter. You have to actually see it happening. I mean, I know what I'm talking will not sound very rational, but I've seen it happening. And that there in the committee, there'll be one person who will vouch for you. Only one person is all you need. That one person out of those 20 people sitting in the committee, that one person believes in you. Because, see, all of them are related to each other, they know each other. It's like if one person says this is a good product, so the whole discussion goes in the direction that this is a good product or not so good product. If one person says it's a bad product, the whole discussion will go in the direction whether it's a bad product or a very bad product, regardless of what you speak after that. So you have to be careful about how you present, and that is why there is a presentation. It's not just you fill up a form and send it. The information they have in presentation, you just don't have to give the information, because that you've already shared in your form and your presentation and application which you've already shared. You're there not to give the information, you're there to give your belief, your how you feeling about it, what is the kind of conviction you have. If that is in place, I think it should work. I mean, I don't know if I answered, but this is what I could say.
That's a very good answer, actually, because I think the ability to recognize what they're looking for is that passion. They're looking for that gleam
Yeah,
in your eye. They're looking for your sort of soul and commitment, and that is exactly what you did. Your second presentation, you took personal ownership and pushed it through.
exactly. So did I?
Prakhar, do you have any follow-up question on that?
No,
I mean,
ma'am. Right.
yeah, please.
That was all I was looking for. Thank you.
Great.
Again, Sanjeev sir, thank you for this talk. Like, I have attended many talks before this, but yours was quite insightful. Thank you for that.
Thank you.
All right, then maybe it's time to close the session. We've already exceeded 30 by 30 minutes. Cool. So thank you, Sanjiv sir. Thank you, Anupam, for giving your 90 minutes of your time for you know uh, enlightening the audience on the entire trajectory of product development, what all where all you can go wrong. And it has happened with, like, it usually happens with everyone, so you learn from your mistakes, but it's good sometime to learn from others mistake. And so yeah, I mean, thank you all for attending the session. If you have any queries, get in touch with our team. I've already um, shared the email ID where to contact you. So yeah, thank you everyone.
Thanks, everyone. Thanks very much for your
Yeah.
attention and your kindness. Bye. Bye, Anupam.
Bye bye.
Bye, Aditi.
Bye
Bye.
Anupam.
Thank you, sir. Thank you for your time. Thanks, Aditi. And
Anytime.
thanks everyone for listening to us.
Yeah, okay. Thank you so much to all of you.